Hello everyone, how are you all? I hope you all are doing good. So, being a speech language pathologist, I'm here today to share about one of the language disorders called aphasia, since it is June, the month of Aphasia Awareness Month. So, what is aphasia? Aphasia is a medical condition in which the person's ability to understand speech and ability to speak, communicate using language is lost due to brain damage. And the causes for aphasia is stroke, head injury, brain tumor, infection, or dementia. The symptoms of aphasia in general are trouble speaking clearly, trouble understanding speech, trouble writing clearly or understanding written words, trouble remembering words, and trouble remembering object names. The most common cause of aphasia is a brain stroke, which can affect any age population, but mostly occurs in elderly population. So, what is brain stroke? A brain stroke, sometimes called a brain attack, occurs when something blocks blood supply to the part of the brain or when a blood vessel in the brain bursts. It is again a medical emergency which requires immediate attention. And how can you identify when a person is having a brain stroke? So these are the most common symptoms of brain stroke, which is face drooping towards right or the left side. Second, sudden trouble seeing when a person complains about difficulty seeing something. Third, arm weakness. Fourth, loss of coordination. Next is nausea, then fever, and most evident symptom is trouble speaking when a person has slurred speech, when a person is not able to produce certain words or the sentences, and then next sudden confusion. So these are the common signs when you can really identify when a person is going to have the stroke. Looking at the types of aphasias, there are five major types of aphasia, which is Broca's aphasia, Wernicke's aphasia, global aphasia, anomic aphasia, and conduction aphasia. So let's see one by one what are these different types of aphasias. First, Broca's aphasia. So, Broca's aphasia occurs when a part of the brain called Broca's is damaged, which is responsible for production of speech and as well as for motor movements. So, in this condition, a person might be able to understand what we are saying, but may not be able to speak fluently. And they have symptoms like they won't be able to formulate proper grammar and unable to complete sentences, and they might be saying phrases like cup me instead of saying I want a cup, and they might not be able to speak for fluently. Second, Wernicke's aphasia is a condition where a part of the brain called Wernicke's is affected. In this type of aphasia, a person has difficulty understanding what we are saying, but might be speaking fluently, which has non meaningful words or incorrect words. Third is global aphasia, which results from extensive damage to the large areas of the brain responsible for language production. And in this type of aphasia, a person is not able to speak as well as understand speech. Fourth is conduction aphasia. In this type of aphasia, a person has difficulty repeating words or phrases or sentences. Fifth one is anomic aphasia. In this type of aphasia, a person has word finding difficulty, as in a person might be able to recognize, identify, or comprehend speech, but might not be able to name the things correctly. Lastly, the treatment of aphasia involves a teamwork, which is medications, speech therapy, occupational therapy, and physiotherapy. So, with this, I end here. I hope this video was informative and helpful for you. For more such videos or queries, you can follow my page, that is fatima.rehab_cdc on Facebook and Instagram. Also, you can let me know about your reviews or if you would want to know about more such topics in the comments. Thank you.